Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for this study. I hope you will make use of it, my dear friends. Thank you very much. So today we shall have the continued portion of newborn care. So far already we have covered almost all 9 topics, and all the 9 topics are related to Ayurveda care of the newborn. So yes, today we will have the continued portion of the same. In the last class we have been discussing about Snana Abhyanga, baby massage and certain precautions, etc. So today we will consider about Jata Karma. In the list given by either Charaka, Sushruta or Vagbhata, you find one term in Navajata Shishu Paricharya in the table, that is Jata Karma. Now what actually mean by Jata Karma? The order where Jata Karma is indicated according to different authors it is different. What exactly the meaning of Jata Karma? So these are some of the references given from Charaka, Sushruta, Kashyapa, etc. So what Charaka says is Ato Anantaram Jatakarmam Kumarasya Karyam Tadyata. In the Jatakarma procedure, what are the steps? Madhusarpishi Mantropamantritehe Yatadnyayam Pratamam Prashitum Dadyat Stanam Atam Urdham Eteneva Vidinaha Dakshinam Patu Purastat Prayachet Atatha Shirshataha Stapayet Udakakumbam Mantropamantritam. So this is told by Charaka. What I mean to say is the steps involved in Jata Karma Samskara according to Charaka is mainly 3. Okay, so there are 3 steps. What is that? First step is Madhusarpishi Mantropamantritehe Yatarthnayam Pratamam Prashitam. That is mixing of Madhu and Grita with some other substances and giving the baby the same preparation for licking. This is the first step. Second step is beginning or initiating the breastfeeding as early as possible, preferably from the right breast first. Third step is keeping a Udaka Kumbha, that is the water filled in the pot above the head level of the baby or in the room where the baby has been kept. So these are the 3 main steps of Jatakarma Samskara as mentioned by Charaka. But if you look into the explanation of Kashyapa and explanation of Ashtanga, explanation of Sushruta, you don't find all these 3 things. There what they say is Madhu and Grita should be taken in the equal quantity. Quantity actually not mentioned. Matram na ukta samam gravyam. Therefore we will take it as equal quantity. And then it is mixed with some of the other drugs also. Then it is given for the licking. Okay, so this is what is told for Jatakarma Samskara by authors other than Charaka. But Charaka explained 3 important steps. Okay. Now these are the references, you can go and look into that. Now let us see what is Jatakarma. The word Jatakarma is a complex, the word Jatakarma is in this context refers to Jatakarma Samskara which should be done immediately after birth. Actually, Jata Karma is one of the steps of Navajata Shishu Paricharya, but it has been also called as Jata Karma Samskara. Now, what do you mean by Jata Karma Samskara? In the context of Samskara, we find a Samskara which is called Jata Karma Samskara. That Jata Karma Samskara and as a step in Navajata Shishu Paricharya, Jata Karma, actually they are one and same. Okay, so word Jata Karma in this context refers to Jata Karma Samskara which should be done immediately after birth. Grita and Madhu is mixed in equal quantity and it is added with Swarna like substances and given for licking to the newborn babies to initiate the feeding reflexes and also for the initiation of the immunoprotective phenomena. Now basically talking about Jatakarma Samskara, it has got 2 important goals. The first goal is checking the feeding reflexes because the next step in Jatakarma Samskara according to Charaka is initiation of the feeding. If you want to initiate the feeding to the newborn baby, priorly you have to check all the feeding reflexes. We have got 3 important feeding reflexes. One is sucking reflex, rooting reflex and as well as swallowing reflex. Now what we want is all the three reflexes should be in coordination. If all the three reflexes are there in this coordination, then only you can initiate the feeding. Suppose the baby is sucking well, rooting is good, sucking is well, but swallowing is not coordination with the rooting and sucking, then there is every chance of aspiration, and this is not an indication for initiation of the breeding. Feeding should be only initiated after these three reflexes are present in a coordinated way. So, the first goal of this Jata Karma Samskara is checking the feeding reflexes to initiate the breastfeeding as early as possible. Second role of this Jata Karma Samskara is for the initiation of the immunoprotective phenomena. Okay, from the birth itself, first day, first hour itself, we start stimulating the body immune system, body immune cell for their proper sensitization. We are trying to sensitize the body immune system against so many external stimuli, external toxins, etc. So that we will discuss later. So this is actually two important aim of this Jata Karma Samskara. Initiate the feeding as early as possible by checking the feeding reflexes. Initiate the immune response phenomena in the body by causing earlier sensitization of the immune cells as early as possible. Okay, now we shall see. However, the Charaka explains three important steps in Jata Karma Samskara, as I told. First step is Gritha, Madhu are mixed together and it is given for licking after even adding with some of the Swarna like substances. But Charaka is not clearly mentioned about Swarna or adding substances. He only says Madhu and Gritha should be mixed together and given for licking. Then second point is start feeding from the right breast, Dakshina Parshvena. Third one is keep the Udak Kumbha, that is a pot which is filled with the water above the head level of the baby, maybe in the room where the baby has been kept. So this particular explanation suggests that this is a process of initiation of the feeding. Gritha and Madhu, which are given for licking, helps or enables checking of the sucking and rooting and swallowing reflexes for its coordination, and once it is ensured, then the feeding can be started as early as possible. So here Madhu Gritha taken in a very small quantity. One cannot say that it is a prolactal feed. Okay, you cannot say it is just like a trophic feed. A small amount of the feed which is given for initiation of the GIT, that is called as GIT peristaltic movement, that is called as trophic feed. Here it is almost like a trophic feed where we are taking very small quantity of Madhu and Gritha mixed together and we are just keeping it over the mouth so that we are trying to check whether sucking, rooting and as well as swallowing has been taking place normally or not. Now you can ask, simply you put the thumb after cleaning and check the sucking and rooting. Okay, that's right. But you cannot check the swallowing reflex by that. You cannot see the coordination between the sucking, rooting and swallowing reflex. To check the swallowing reflex, you should give some small amount of the feed. Now once baby is sucking well, your finger, and then it is taking that Madhu and Gritha inside and it is also swallowing it properly in coordination, then it is the right time to initiate the breastfeeding. This is a very important thing, checking of the feeding reflexes. So normal babies should be breastfed within 30 minutes after the delivery. So there are no other criteria to start the breastfeeding. As early as possible you have to start. If the mother is ready, if the baby is ready, you have to start. Only thing is, baby should be able to suck and mother should be able to feed. Baby should be able to suck means baby should be able to suck and swallow, and mother should be able to allow the baby to get suck. These are the two important criteria. So this particular Jata Karma Samskara is going to check this particular feeding reflexes. Now word Jata Karma refers to different routine procedures followed in the. Now there are two terms, one is Jata Karmas and Jata Karma Samskaras. Okay, Jata Karmas means those karmas which is done immediately after birth. There are so many steps are there, so many procedures are there. Whereas Jata Karma Samskara is a single procedure which is done immediately after birth. Okay, so we have to make a differentiate. Jata Karma and Jata Karma Samskara is different. Now this is Jata Karma Samskara. Okay, when he says Jata Karma, it is Jata Karma Samskara. Okay. So rest of the things where how it will going to help in initiation of the immune sensitivity of the body. So that we have already discussed in the portion of Swarna Prashana. In the context of Swarna Prashana, 3 or 4 videos are there where I have detailedly explained how this Madhu Ghrita combination will go into help. Now only thing we have to make clear that there is a clear cut difference between the procedure of Jata Karma Samskara mentioned by Charaka, Sushruta and Vagbhata. Okay, Charaka mentioned 3 important steps in the Jata Karma Samskara. One is keeping the, one is Madhu Ghrita licking, second is right breastfeeding initiation, third is keeping the Udaka Kumbha above the head level of the baby. The reason why the Udaka Kumbha has to be kept above the head level of the baby or inside the room is to check the temperature. We know that baby has to be kept in a proper temperature. Now if it is a summer season, there should not be any hyperthermia or hypothermia. If it is a summer season, you keep a pot filled with the cold water, the temperature of the room will be naturally get adjusted. If it is a hot season, keep a Udaka Kumbha filled with the hot water, and naturally by ventilation and all this different methods of heat conduction, the temperature inside the closed room will be get maintained. So again, this particular thing shows the knowledge of importance of temperature in the normal growth and development of the baby. Whereas when you talk about Ashtanga Sangraha, along with Madhu Ghrita, he mentioned so many other drugs. He mentioned Endri, Brahmi, Shankapushpi, Vacha, Kalka. Many drugs has been given mixed together with Madhu and Ghrita and given for licking. Now this looks that rather than checking the along with the checking of the reflexes, it also aims to induce the immunosensitivity action of the baby. Okay, many of the drugs are Medhyarasana drugs, many of the drugs are immunological drugs, immuno-enhancing drugs. Similarly, when you talk about Sushruta, there also he says the same thing. It should be given with Madhu and Ghrita, and in the first day, second day, third day, he give different schedules. Now probably Sushruta is dealing with preterm babies or low birth weight babies where sucking and rooting reflex is not properly developed, and he is trying to give the small amount of the feed by licking methods. And once they are ready to take the normal feed, then from the 4th day onwards or 5th day onwards, the routine, the feeding schedule will be started. This also I have described in so many other videos. Therefore, I am not repeating. Similarly, Kashyapa also says that Amathya Madhusarapibhyam lehayat kanakam shishum. There also he says that, but that particular aspect is mentioned in the context of Swarna Prashana. So therefore, Kashyapa's explanation we are taking for the Swarna Prashana preparation, not for the Jata Karma Samskara. Swarna Prashana Samskara and Jata Karma Samskara are totally different, although in both conditions we are using gold and etc. Okay, but Jata Karma Samskara is done immediately after the birth, aim is only 2. Whereas Swarna Prashana Samskara is started afterwards in the context of Lehana, it is mentioned, and that the purpose is not checking the feeding reflexes, that the purpose is only with the immunological development or enhancement. So next topic what we want to discuss is about Garbhodaka Vamana. So that we will discuss in the next class. Thank you very much.